A new federal executive order on vaccines brings scrutiny to the MMR vaccine. Now, the order recommends splitting the vaccine into 3 separate shots. Fox 43's Milena Brown has a reaction from Penn State Health and the Pennsylvania Department of Health and what they recommend for parents.
For parents trying to keep up with changes to vaccine recommendations, the biggest question may be simple. What does this mean for my child?
Currently, I wouldn't expect much changes. I think the biggest thing from that executive order, at least one of the focuses has been this idea of splitting up the MMR vaccine.
The executive order calls for federal health officials to review current childhood vaccine recommendations, and it encourages the development of separate vaccines for measles, mumps, and rubella.
Essentially, no one is producing those individual vaccines right now, so you'd have to have a company that wanted to produce these vaccines individually. Then that company would have to go through a testing, trials and approval before it'd be available. So I wouldn't expect that to happen anytime soon.
Meanwhile, Pennsylvania Health Secretary Dr. Deborah Bogan says the Commonwealth will continue to base its public health decisions on medical science and evidence. In a statement, Bogan says splitting up combination vaccines like MMR could create additional hurdles for parents and extend the amount of time young children are vulnerable to preventable diseases. So what should parents do now? The physician I spoke with says families should not make changes to their child's vaccination schedule on their own and says speaking with your child's doctor is the best place to start.
I think pediatricians or their primary care doctor are the best sort of sources for information and questions. But yeah, I would just emphasize that these are safe and effective.
Milena Brown, Fox 43 News.
Meanwhile, the Pennsylvania Department of Health has confirmed 232 total measles cases this year. That includes 57 new cases in the first full week of August. 38 people have been hospitalized. No deaths have been reported. The department says no confirmed cases are among people who have been fully vaccinated against measles. And Lancaster County has accounted for 133 of those cases, by far the most of any county in the Commonwealth.